Hello, I'm Dr. Wickham Simonds. I'm an obesity medicine specialist in the Triangle area of North Carolina, and this is Obesity Medicine Perspective. So, on the last video, we talked about a general review of some of the concepts I've covered in previous videos, and I wanted to take the chance to talk a little bit more about the disease of obesity and some kind of misconceptions about it. So most people don't understand, and this includes a lot of physicians, and it's not, they just haven't been exposed to the science yet. So when you're a physician, as a background, you just get a ton of information. And let's say you're a neurologist or an OBGYN or a pediatrician, you've got to focus on your specialty, and there's just a ton of information you have to know. So sometimes when information comes out in other specialties like obesity medicine, you're not the first to get it, and it takes you a while for that information to filter down into your specialty and for you to understand the information. So what I'm about to tell you, I guess, is things that people may not know, which is why I want to bring it up. And so the main concept I want you to know about this, that I frequently educate patients about and that they don't know about, is that obesity is a lifelong disease. It is a chronic, relapsing disease that has to be managed. And once you have it, you do not ever get rid of it. And I want to compare it to alcoholism. When you're an alcoholic and you recover from your alcoholism and you go through a rehab and you're successful, maybe you're attending AA meetings and you're successful at not re-engaging in the act of drinking, you still have alcoholism. And everybody who's gone through that will tell you that. It is a chronic disease and you're prone to relapsing. And this is the way that obesity works. Once you've accumulated too much body fat initially, your physiology changes. And this is important. It changes permanently. So that even if you lose all the weight you need to lose and all the body fat you lose, your physiology never returns to normal. And you're very, very prone to weight regain. And your body actively uses multiple organ systems to try to make you do it. So it is important that you recognize that fact, because once you've lost the weight, there's no turning your back on it and going back to your old ways and saying, I'm going to do all of these things that I used to do, and from a food and drink and activity standpoint, I'm going to do all these things I used to do, and I'm going to be able to get away with it. That is not true. You'll have to actively manage your weight even when you're at a normal weight, and even when you're at a normal body fat percentage. You'll have to actively manage that just like you manage your checkbook. You know the balance in there, and that dictates your spending habits. And that's exactly the way it is with obesity. And I want to drive that point home. If you need medicine in the long term, and this is an important point, you can get it. Okay, when you manage high blood pressure or diabetes or arthritis or a disease like that, and you get it under control with medicine, you don't then say, well, we're going to quit taking medicine because it's now under control. You manage it with medicine. And so I have patients who need medicine either periodically or regularly in the long term to manage their weight. And there is absolutely nothing wrong with that, and it's okay to do that. Okay, it's really something that most people think, well, I take my diet medicine, I lose the weight, and then I'm done. And I never get to take it again. And that's baloney, and it's garbage, and you need to know that you always have access to it, and if you need it to control this condition, then you should come and get it. And we're always going to be there prescribing it for you if you need it. So remember this main point: obesity is a chronic, relapsing, long-term disease that needs to be managed even when your weight returns to normal. Now, if you have not followed us on Facebook and Twitter and watched these videos and registered with the front office staff for a free InBody 770 body composition analysis test, I want you to do so. This is a great test. It's an expensive test, and we're giving it away for free. Please sign up to get that. Yeah, don't miss out on it. So, until the next video, I'll give you the tools, you give me the effort, and together we overcome obesity.